Paige. She is a registered dental hygienist at Wilkinson Dental. Let's talk a little bit about what all will happen when you go for one of those preventative checkups. What do you need to have done?
Well, first off, when you come in, obviously here you're going to get a tour, you're going to get familiarized with the office, you're going to get introduced to the doctors, of course, and the hygienists. And what you're going to do is you're going to get your basic x-rays. If you're having any symptoms, you're going to get maybe an extra x-ray to see around the root of the tooth, see if anything's going on. And then you're going to get your checkup with the doctor. Of course, you're going to get an oral cancer screening along with that. We're the first, in line for that as far as checking over for that. The doctor's going to tell you what your treatment needs are, if you have any cavities or anything like that. And then, of course, you're going to get your gums assessed, see if you have gum disease. We do that every time that we're in your mouth as a hygienist. That's our duty. And then, of course, we're going to get you cleaned up and floss and tell you what your needs are and how to better take care of yourself at home.
And some people will come in and they'll find that they're in really good shape. They've done well, they brush, they floss, they've done pretty much everything right. A lot of times though, there are underlying problems that you might not catch without one of these. What are some of the things that these checkups might catch?
Well, believe it or not, a lot of people think that if they have a cavity that it's going to hurt immediately. So a lot of people will have cavities in the flossing areas, or they may be great brushers but they're not great flossers. And so we'll catch a lot of those flossing cavities and they would expect them to hurt, but that's not necessarily the case. When you're hurting, that's when you're in really bad shape. So we want to catch them early, and that's why we take the cavity detecting x-rays every 6 months.
And there's also things like gum disease that you might run across.
Exactly. Gum disease is very prevalent. We catch it in the early forms. We let people know. We try to educate our patients and let them understand that it's not just something to blow off. It's very, important to the entire body. A lot of people don't realize that what's in your mouth can affect the rest of your body, and so we try to educate our patients. Periodontal disease, 3 out of 4 adults have it, and a lot of people don't know it. So we try to make sure that they're aware of it, how it's going to affect their body, how it's going to affect their teeth and their overall health.
And another thing, sometimes people say, well, it's hard for me to get to the dentist, I work long hours.
Right.
But you guys have figured out a way to help make it a little bit user-friendly to get in and get these important checkups and cleanings. Talk about your hours that you're open.
Yes. Right now we are very happy to have extended our hours for our patients. Currently on Thursdays we're open from 7 a.m. to 7 p.m. So that helps those people who work those 9 to 5 hours. They can't use that as an excuse anymore, hopefully.
Exactly.
It also helps out the parents who have kids in school that don't want to necessarily get their kids out of school early. So they can bring them in later in the evenings, and it makes it more workable for them. We're also open on Fridays, whereas used to be we were open Monday through Thursday. So now that we have 2 doctors in our business, we're very happy to have both Dr. Wilkinson and Dr. Gray, and so it's working out very nicely. We're staying very busy.
Exactly. So that's good. You've got plenty of hours for people to get in. So they're, like you said, no excuse. Talk about maybe you're having sort of a special right now to try to get people in to get this important checkup? Yes.
Right now we're running a special. It's $99 for a comprehensive exam and x-rays and a cleaning. And it's a basic cleaning. A lot of times people come in and they haven't been in for years and they need a little bit more than a basic cleaning. But this helps them get in, get their comprehensive exam and x-rays, help them determine what all their needs are, and we can get that initial cleaning and make things feel better and then get them on their way to good health. So.
And this is obviously a state-of-the-art office. You've got the TV screens on the ceiling, things like that to make you very comfortable. This is nothing to be afraid of, but things like gum disease and other diseases that may result from it is something to be afraid of.
Yes, very much.
Paige from Wilkinson Dental, thank you so much.
Thank you, it's my pleasure.
I'm loving these frozen lemonades and limeades, right?
Peter, you need to be chill.
Okay.
Like my frozen cherry limeade.
Right, chill like my frozen blue raspberry lemonade.
There you go.
So what do? I've never done this before.
Clear your mind.
Okay.
Blank slate.
So I gotta do that for a whole hour and a half?
You think that's hard?
Yeah.
Because I've been doing that for like 40 years now.
He's not kidding. It's all empty up there.
Let's begin.
Chill out with tons of new frozen lemonades and limeades. And don't forget half-price shakes after 8. Also get a slush when you download the new Sonic app.
911, what's your emergency?
Someone just slammed into us. The guy's drunk, and he's trying to drive away.
Are you hurt? What's your location?